Good evening. This is group 4 presenting on breast cancer. The group members are Candy Michael, Janica Oliver, Nadia Mackley, Jada Lyda Batiste, and Taisha Noah Woods. So what is a case of breast cancer? Breast cancer is the confirmed presence of malignant cells arising from the epithelial tissues of the breast ducts or lobules. It is characterized by abnormal and uncontrolled cell proliferation, which may invade nearby tissues or metastasize to distant sites. How do we confirm breast cancer? The confirmation of the disease is primarily achieved through histopathological examination, also known as biopsy, which remains the gold standard for diagnosis. Supporting diagnostic methods include mammography, breast ultrasound, or magnetic resonance imaging, MRI, to identify suspicious lesions prior to biopsy. Trends in population according to age range, the incidence of disease. The incidence of breast cancer increases progressively with age, showing the highest rates among women over the age of 50. In contrast, younger women under 40 years old generally exhibits a lower incidence rate. However, when breast cancer does occur in the age group, it tends to be more biologically aggressive and diagnosed at a later stage due to lower rates of routine screening. Mortality decreased significantly in recent decades due to early detection, public awareness, and advance in treatment. Example, targeted therapy, chemotherapy, or hormone therapy. Mortality increases with age due to coexisting conditions and treatment tolerance issues. High-income countries have higher survival rates due to better screening and healthcare access, while low and middle-income regions face higher mortality.
Okay, so reasons behind the age trends. The incidence of breast cancer increases with age due to older women experiencing greater cumulative exposure to estrogen and a higher likelihood of genetic mutations over time, which raises their risk for cancer development. Environmental influences and lifestyle factors across their lifespan also contribute to this trend. Additionally, younger women are not routinely screened, which results in fewer cases being detected in that age group. Next slide, please. Reason behind the mortality trends. The rise in mortality with advancing age is mainly due to older adults having comorbidities that limit their ability to undergo aggressive treatment. However, overall mortality rates have declined globally because of advances in early detection, increased public awareness, and effective therapeutic treatment options. In contrast, younger women often experience higher mortality relative to incidence due to their fast-growing tumors and delayed diagnosis. Next, please. So what is a risk factor in epidemiology? A risk factor is a characteristic, condition, or behavior that increases the likelihood of developing a disease or injury. Next slide, please. So with breast cancer, there are many risk factors as can be shown above, but today we'll be looking at three major risk factors associated with it, being family history, reproductive history, and dense breast. Next slide, please. Family history. Having a family history of breast cancer increases a person's risk of developing the disease. The risk is especially higher if a first-degree relative, being a mother, sister, or daughter, is affected, or if several family members on either side of the parent's family have had the disease. The risk for breast cancer is even higher when it occurs at a young age, or when there is a family history of ovarian cancer or breast cancer in a male relative. These patterns often suggest inherited genetic mutations such as BRCA1 or BRCA2, which increases the susceptibility rates. Next slide, please. Reproductive history. An early onset of menstruation before the age of 12, late menopause, which could occur after the age of 55, or having their first child at an older age, or nulliparty, meaning never have given birth, all contribute to prolonged exposure to ovarian hormones. This extended exposure to estrogen and progesterone increase the risk of developing breast cancer. Therefore, a woman's risk of developing breast cancer correlates with her lifetime exposure to estrogen and progesterone, as prolonged hormonal stimulation promotes breast cell growth and increases the chance of genetic mutations. Next slide, please. And lastly, our last risk factor being dense breasts. When a women with dense breasts face greater risk of developing breast cancer, although the exact reason remains unknown. Dense breast contains more glandular and fibrous tissue than fatty tissue, which can make it more difficult as it obscures the visibility of tumors on a mammogram, as both appears white, leading to potential misdiagnosis. While patients with dense breasts may be increased at an increased risk, they are more they are not more likely to die from breast cancer than those with non-dense breasts. I'll now pass you on to my colleague.
Prevention. Primary prevention refers to the measures that are taken before the onset of a disease to prevent its occurrence. The goal is to reduce exposure to risk factors and promote protective factors, thereby decreasing the incidence of disease within the population. Next slide. So, three primary prevention measures for breast cancer. One, promotion of healthy lifestyle and weight management. Two, limiting alcohol consumption and avoiding tobacco use. And three, education and awareness on breast cancer risk factors. So, promotion of healthy lifestyle and weight management. This is to encourage women to maintain a healthy body weight, engage in regular physical activity, and adopt a nutritious diet that is high in fruits, vegetables, and fiber, while low in saturated fats and processed foods. The point of this is to reduce the obesity and lack of physical activity increase estrogen levels, which can stimulate the growth of breast cancer cells. Maintaining a healthy weight and being active to help regulate hormones, reduce body fat, and strengthen the immune system. These actions effectively lower the risk and incidence of breast cancer in the population. Two, the limiting of alcohol consumption and avoiding of tobacco use. This is to implement public health campaigns and policies aimed at reducing alcohol intake and discouraging smoking among women. This is effective as alcohol increases estrogen levels and can damage DNA in breast cells, while tobacco contains carcinogens that can contribute to cancer development. Reducing alcohol and tobacco use significantly decreases the likelihood of initiating cancerous changes in breast tissue, thereby reducing disease incidence. And thirdly, education and awareness on breast cancer risk factors. This is to develop community education programs that inform women about breast cancer risk factors, protective behaviors such as breastfeeding, and the importance of lifestyle modification. This is effective as it educates as education empowers women to make informed health choices and adopt preventive behaviors early in life. When women understand the modifiable risks, such as obesity and alcohol use, the population level burden of breast cancer decreases through prevention rather than treatment. Next slide. Secondary prevention. Secondary prevention involves strategies for the early detection and prompt treatment of a disease to halt or slow its progression. The aim is to identify disease at an early asymptomatic stage, improving outcomes and reducing morbidity and mortality. Next slide. So, one secondary prevention measure for breast cancer would be having regular breast cancer screenings, also known as mammograms. Routine mammogram screening is recommended for women typically aged 40 to 74 to detect breast cancer at an early, more treatable stage. This is effective as mammograms can identify um mammograms can identify small, non-palpable tumors before symptoms appear. Early detection allows for timely intervention, often requiring less aggressive treatment and leading to improved survival rates. This measures reduces the impact through decreased mortality and morbidity, and lowers the population burden of advanced breast cancer. I'm now handing on to my next colleague.
Okay, so I'm doing tertiary prevention. So what is tertiary prevention? Tertiary prevention can be defined as the ease of the impact of disease on an impacted person who will have lifelong effects of the disease. It can be achievable by assisting persons in managing their disease through rehabilitation programs or support groups. Next slide, please. When a patient has undergone chemotherapy and the removal of the tumor, the effects of the radiation and tissue scarring can result in fatigue, pain, fragility, and the swelling of lymph nodes, known as lymphedema. As such, one tertiary prevention measure which can be applied in managing breast cancer is rehabilitation programs. These programs consist of guided physical activities, yoga, treatment of lymphoedema, as well as psychosocial interventions. It has been evident that the impact of the disease has been reduced through when the following rehabilitation techniques are met. These are physical activities. Guided physical activities have shown positive impact on the movement of shoulders, reduced lymphoedema, pain, and exhaustion. Yoga and psychosocial intervention. The mental state of breast cancer patient can be negatively impacted during and after treatment. As such, the practice of yoga reduces mental health conditions such as anxiety, depression, and insomnia, or psychosocial interventions such as cognitive behavioral therapy have shown positive impact. Next slide, please. So we're going to look at a scientific journal which conducted research related to the detection and diagnosis of breast cancer. So the title of this scientific journal is The Multi-Classification of Breast Cancer Abnormality Using Convolutional Neural Network, also known as CNN. And the link is provided, and the aim of it was improving the detection of abnormalities in the breast through mammograms, which are calcifications, asymmetrical carcinoma, and mass, by having early detection and precise diagnosis through the use of CNN. So the findings was, as stated, breast cancer is determined by abnormalities, and through using CNN program manogram, an 88% accurate detection of these four abnormalities were discovered, which can assist in the early detection of diagnosis of breast cancer. I now pass you on to my colleague.
Two difficulties in implementing detection and diagnosis of breast cancer in Trinidad and Tobago. Firstly, limited diagnostic resources and accessibility. In Trinidad and Tobago, access to advanced breast cancer screening technologies such as mammographies, ultrasounds, and MRI is limited, especially in rural and public healthcare settings. Many public hospitals face equipment shortages, delays in imaging, and a lack of trained radiologists and pathologists. These constraints can result in late diagnosis, reducing the chance of successful treatment and increasing mortality rates. Secondly, socioeconomic and cultural barriers. Many women delay or avoid screening due to fear, stigma, cost, and misinformation about breast cancer. In addition, cultural beliefs and lack of awareness regarding the importance of early detection contribute to low screening involvement. Women from lower socioeconomic backgrounds may also lack access to private clinics, where diagnostic services are more readily available. As a result, most cases are detected at advanced stages when treatment options are more limited and less effective. Next slide, please.
Okay, so I'm going to discuss now the scientific journal which conducts research related to the management of breast cancer. So the title of this journal is Breast Cancer, an overview of current therapeutic strategy, challenges, and perspectives. And the link is there. So the aim of this journal was to outline the therapeutic interventions for breast cancer to assist in the management for oncologists. The findings was all therapeutic interventions such as breast conserving surgery, adjuvant chemo, and radiotherapies have improved outcomes with longevity and chances of the cancer reoccurring to be low. Secondly, the second finding was the developing therapies such as targeted therapy and immunotherapy aims to decrease the after effects which patients presently face and to improve management.
Now I'm going to give two difficulties in implementing management of breast cancer in Trinidad and Tobago. Firstly, limited oncology infrastructure and workforce. Managing breast cancer effectively requires multidisciplinary cares, surgeons, oncologists, radiologists, and counselors. However, in Trinidad and Tobago, They face shortages of oncology specialists, radiotherapy machines, and chemotherapy drugs, particularly in public hospitals. This leads to long waiting time for surgery and treatment initiation, reducing survival rates and quality of life for patients. Secondly, challenges with follow-up care and support services. Post-treatment care, including rehabilitation, mental health counseling, and survivorship monitoring is often inadequate. Many patients experience difficulties accessing ongoing support services such as physiotherapy for lymphedema or psychological assistance to cope with treatment-related stress. These gaps undermine tertiary prevention and contribute to a higher risk of recurrence and lower quality of life after treatment.
In conclusion, age, genetics, lifestyle, and access to healthcare resources all have a significant impact on incidence and mortality of breast cancer, which continues to be serious public health concern. Even though improvements in diagnostic techniques and treatment strategies have led to better results worldwide, nations like Trinidad and Tobago still struggle with follow-up care, oncology infrastructure, and screening accessibility. There is hope for earlier diagnosis and better disease management as scientific research keeps improving detection methods and available treatments. In order to lessen the burden of breast cancer and enhance the prognosis for those who are impacted through strategy that incorporates prevention, early diagnosis, efficient treatments, and ongoing supports is necessary. And this is the end of our presentation. Thank you.